immunisation and the treating of vaccine injury. And as we'll talk about shortly, two sides of the coin in a way. We live in strange times at the moment. I'm recording this toward the end of March 2020, when COVID virus, of course, is dominating everything. But the issues that I'll be talking about today are here present all the time. So basically, there'll be a little introduction. In the first part of the discussion, I'll be talking about treating vaccine injury. In the second part, I'll be looking at immunisation options. How can we avoid vaccine injury? And what is the option? And then drawing some conclusions. As I've said in this introduction, the aim is not to oppose any health interventions. This is not an anti-vax talk, but to present factual evidence regarding options. Unfortunately, the public debate concerning the prevention of infectious diseases has been stifled, that's the nice word for it, by a pharma-compliant media and by a similarly compliant health bureaucracy. And any suggestions regarding options are attacked as unscientific. And I'm particularly talking about my own country now, Australia, but there are a few countries in the world which are not totally shackled by the pharmaceutical influence, but there's very few, to the shame of us all, really. The science has been corrupted and balanced information is hard to find. By the way, one of the best presentations about this was done at Harvard University Law School, one of the most prestigious law schools in the world, back in 2013. And you can still find it online for free. Search for the SAFRA Ethics Lab at Harvard University, pharmaceutical, and you can get it. But hopefully what you'll see and hear now will have the balance needed to make informed decisions, because that's my goal, to try and help you to make informed decisions. So I always see the issue of immunisation as a two-sided coin. I mean, all coins are two-sided. But the issue of how to provide safe and effective immunisation on one side, and then the treatment of vaccine injury on the other side, are really so closely connected as issues. They form two sides of the one coin. I mean, when we're talking about immunisations, we should always try and make a person as healthy as possible. But just being healthy in general will not necessarily maximise protection against particular targeted diseases. And I know that there are a range of different views out there. Some people believe that viruses and bacterium don't cause any illness at all, that it's all to do with how we are. Well, I believe both. I believe how we are makes a massive difference in how we are vulnerable to both viruses and bacterium, as well as everything else on the planet. But I also do believe that practical real-world experience shows us that even very healthy people can get simple infectious diseases. Now, vaccination does provide a level of protection which varies. The flu vaccine, 40% in a good year, 15% we had in Australia a couple of years ago, to significant protection, for example, measles. But nothing is ever 100%, of course. Not even getting the disease once is 100% guarantee. However, vaccination is a potentially toxic intervention, and evidence clearly shows it may cause injury. Well, homeopathy has options for both sides of the coin. First of all, how to treat vaccine injury, and secondly, how to prevent it by offering a method of immunisation that evidence shows is similarly effective as vaccines without any risk of toxic damage. But we'll come to that. So, let's look at vaccine injury. Is there evidence that vaccines do cause injury? And the answer is an unambiguous yes. And if anyone claims they don't, they're either ignorant or else they're deceitful. And I'll let them make their choice between those two options. And I've noted down here 6 ways that we can show that vaccines cause injury or may cause injury. It doesn't happen in every person. Firstly, if you look at 19 countries around the world that have vaccine injury compensation schemes, billions of dollars have been paid out in these schemes. That's really all you need to know. But we've got more. You look at vaccine manufacturers' inserts to the vaccines and they acknowledge injury is possible. Some government publications around the world deal with vaccine injury. You've got self-reporting systems, the most thorough of which probably is VAERS, the Vaccine Adverse Events Reporting Service from America. Then the last 2, comparisons of the medium to long-term health of fully vaccinated and completely unvaccinated children. Now, you would think that this is a study that would have been done by orthodox medical people right from the word go, decades ago, but it hasn't been, or if it has been, it hasn't been published in mainstream literature. And you'll see that I actually, last year, published in a mainstream journal evidence from 7 small studies looking at fully vaccinated and fully unvaccinated children, and you can see the differences. That'll be coming up shortly. And the final one, number 6, conditions removed by homeopathic potencies of the vaccines. So let's briefly consider these last 2 items. And by the way, I didn't say at the beginning that this discussion is a brief one. I mean, I can spend 2 days talking about these 2 topics. Instead of that, it's 20 minutes on each. So obviously, I'm condensing enormously just to give you an idea, and you can go further with further information at the end if you wish. So the missing evidence. Substantive comparisons of the medium to long-term health of fully vaccinated and completely unvaccinated children have not been published in orthodox medical journals. 7 smaller studies have been published, none of which alone is adequate, but which all show a consistent picture. And it's this consistency which demands more research. Now, I published these in the article referred to there, Reluctance to Vaccinate, Reason and Solutions, Journal of Translational Science last year. So that's a journal article you can get freely available just by following that link. And this is a summary using 3 different averages of the data from those 7 studies. And this is the number of times that vaccinated children have the condition more than unvaccinated children. The first column looks at just a simple average of the data. The second column looks at a weighted average of the data, and the third column looks at a simple average of figures that were statistically significant, because not all of the studies tested for statistical significance. Whichever way you look at it, the figures are alarming, because this is really giving us a little picture into the increased burden of chronic disease caused by vaccination over a period of time. And very often these are conditions that no one associates with the vaccine, except maybe with the wisdom of hindsight. But you can apply this to any country, and millions of dollars would be saved by reducing the burden of these chronic conditions. But it's not just a matter of money. Just think of the suffering and the ruined lives involved with all of these conditions to a greater or lesser extent. It's a high price to pay. Now, if it was the only option in preventing dreadful diseases, it might be a price worth paying. But if it's not the only option, then we should be able to discuss openly and frankly evidence looking at the different options. And parents should be allowed to make choices for their children, and adults should be allowed to make choices for themselves. It is a dreadful thing that no government around the world has undertaken this study, because it needs to be done by a government independent of compromised researchers. So a government, an independent government agency, needs to do this research on a massive scale, publish the results, and then we can have a proper discussion. Until then, we're not allowed to access all the facts. And the final method or way of telling whether vaccines cause problems is conditions removed by homeopathic potencies of vaccines. So collecting symptoms removed by vaccine potencies allows us to develop symptom profiles of different vaccines with the wisdom of hindsight. And this is something I've been doing for some decades now, using homeopathic potencies of suspected vaccines and looking at symptoms removed. Now, basically, the only way that the homeopathic potencies of these vaccines can remove the symptoms is if the vaccine was the cause. Therefore, this gives us, with the wisdom of hindsight, a wonderful view into what long-term damage have vaccines really caused. And this is one example. Here I'm comparing DPT hexa, that's the vaccine with 6 different diseases in it, 6 valent, and the MMR vaccine. Now, along the x-axis, along the bottom, you'll see that I've got a range of conditions, beginning with mental emotional conditions, developmental problems, learning, autism, ADHD, anxiety, and then it goes down through allergies, and then basically from the top of the head to the foot, respiratory conditions like asthma, gastrointestinal conditions, skin, and general conditions. And you can see how the profiles of the 2 vaccines are very, very different, particularly when it comes to mental emotional conditions like learning and developmental problems, autism, and poor interaction with other people. All of those 2 things, it's very clear the difference. Physically, we can see that allergies, the 2 vaccines have quite a different profile, and skin problems, it's a different profile. With some of the conditions, they're very, very similar, like gastrointestinal. So what we can really say is that both vaccines, in fact we find all vaccines, have a real impact on the gut. But depending on the vaccine, the impact in the other part, brain, mental, emotional, and right through the physical system, can be different. So these are the profiles that I've been working on for some years. Now I've recently published the 3rd edition of this book. It used to be called Vaccine Damaged Children. I've renamed it Vaccine Injured Children. 21st Century Tragedy, which I believe is what it is. Treatment, Prevention, Reasons. That's where I publish quite a number of different graphs for different vaccines, also comparing the different DPT vaccines. In the old days, DPT was just that, diphtheria, pertussis, tetanus, just 3 valent, 3 materials from 3 diseases in the vaccine. Now it's hexa 6 valent. And it's interesting to look at the difference. Particularly, we find the difference, not so much physically, but on the mental emotional level. And what we find is that the hexa has a greater impact on things like autism and learning difficulties than the original DPT vaccine, is the 3 valent one. And that's very relevant for America, because whilst Australia's been using hexa for a decade, the Americans have only just started using it. Their incidence of autism is going to go up, and it's pretty bad at the moment. So when we look at the treatment of vaccine injury, the principle of similars directs that a substance that can cause symptoms in a healthy person can remove similar symptoms in an unwell person. So when careful case-taking reveals that the patient's symptoms were likely caused by a vaccine, then potencies of a similar vaccine should be able to relieve those symptoms. Some people say that it's isopathy. Some people say that it's too similar or using exactly the same. Well, it's not exactly the same, because Hahnemann noted himself that when you potentise something it changes. But obviously there is a high level of similarity there. And that leads to what I call HOPOV, homeopathic potency of a vaccine. So that's the summary I'm going to use in the next few slides, HOPOV. And once again, I've been doing this for well over 30 years now. The HOPOV treatment protocol, well, a lot of it's very similar, by the way, to standard homeopathic treatment protocols. There's no single treatment program that fits every case. Every case is different. Every case should be individualised, even if you're using an approach which begins with trying to remove damage caused by vaccines. So you see, I believe in trying to do things as easily and as simply as possible. And if it's clear from the case history that the person has been damaged by a particular vaccine, or vaccines plural, one of the easiest things to do in the long term is remove that damage. Because I can tell you from experience that even really well indicated homeopathic remedies and non-homeopathic remedies can only do so much until that layer of distress has been removed. So careful case taking and flexibility is required. Identification and timing of symptom changes is a key part of the case taking. So it's like detective work. You need to find out with as much detail and certainty in terms of timing as possible what happened and when, and then look at when the patient was vaccinated, and very often you will see a pattern. The starting potency and frequency of the dose depends on the holistic health of each patient, as it does with normal homeopathic treatment. So a person who's weak and debilitated, you may start with a sniff of a 30C using the olfactory system, or putting it in water, or just a single pill. I use olfaction, sniffing the remedy, a lot when a person is very sensitive. It's a wonderful way to start. On the other hand, if the person's much more robust, then you could start with a somewhat higher potency. But if you're in doubt, start low and work up potencies. And the late Dr. Tinner Smits, for whom I had a great admiration, we exchanged occasional emails before his passing. He recommended, as part of his cease therapy, a program, 2 doses of 30 in a week, 2 doses of a 200 in a week, 2 doses of M in a week, 2 doses of 10M in a week, making the first month. Well, I don't always agree with that, in the sense that if a person has strong reactions along the way, you need to modify it. And sometimes it's safe to start a little bit higher than just the 30. Sometimes it's prudent to stay on the one potency for longer than a week, and sometimes it's prudent to space the doses further apart. And I guess Dr. Smits probably did quite a lot of those fine-tunings himself. But it's a great way to start if you're not sure what to do. A range of potencies is required, at times up to 10 mm. Now some people fall off their seats when they hear that you use 10 mm, but if you've got a disturbance which is deeply buried in the person, you need the highest potencies to deal with it. And the whole process can often take years. That doesn't mean it's years before the person starts seeing improvement, but years to complete the process. And this is always a problem. Not all parents are willing to last for a year's, a year or more treatment when they see that their child has improved up to a point where they're verbal, they're interacting with other people, often the enthusiasm to keep going and finish the whole business, get right to the root cause, it slackens off a bit. And unfortunately, I've got cases in my book where a child started really well with the treatment, but then the parents didn't come back and finish it. The patient's symptoms determine progress with both potencies and frequency of dose, just as with normal homeopathic treatment. As Hahnemann correctly said, the symptoms must guide us. They tell us what's happening with the vital force. More than one vaccine may need to be targeted over time, and symptom-specific remedies and or constitutional remedies may be needed along the way to finish a case, just as with normal homeopathic treatment. So very often, using the hope of remedies, homeopathic potencies of vaccines is the first step, but not necessarily the last. Although I've also had some cases where the person appeared to have completely recovered and was functioning completely normally with just using the potencies of the vaccines. Every case is different. Never well since is a key element in every case, and this is what's revealed by careful case taking. The patient has never been well since a particular event. These never well since symptoms effectively record when the system has been shocked on the physical, emotional and or intellectual level. Removing layers of trauma or injury are essential in allowing the self-healing mechanism, the vital force for homeopaths, to resume its job. The goal of treatment, the hope of remedies do not heal the patient. Some people are shocked when I say this to them. They remove layers of trauma that prevent or block the patient's own self-healing force, the vital force in homeopathy, from bringing the patient back to balance. The vital force heals the patient. The vital force brings the patient back to balance because once the blocks are removed, it's able to do that again. And of course, that's not denying the importance of nutritional support, good water, exercise, a peaceful family environment. All of these things, all of them, make a massive difference. But removing the block is often the first necessary step to start the patient on a genuine path to recovery. Now, just to give you some statistics, I talk a lot more about different statistics in the book, and these are results excluding cases where there were no follow-ups. So if we look at 2001, 2008, 2018, basically you can see that levels of improvement have changed over the years. So we're looking at around 54% 2001, a similar 55% 2008, and then 64% in 2018, because between 2008 and 2018 I made a definite effort to try and follow up patients. See, I live outside of Melbourne. I get patients who come and see me who live hours away, sometimes interstate and occasionally overseas. And so it's not so easy for them to follow up. And I am usually so busy that I don't go around chasing patients. So if they don't follow up, the case is not followed up. In the last decade, I've tried to, with the vaccine injury cases at least, I've tried to at least send an email after a period of not hearing from parents to say, you know, how's the little one going? But it's up to them if they follow up or not. So when there's no follow-up, you can't tell whether it's been successful or not. People say, oh, well, that probably means it hasn't been successful, but it actually can also mean the opposite. As any practitioner will know, that you may not hear from someone for years, and then they'll come back and say, oh, it was great what you did before, now I want you to do something else. But they just didn't tell you about it. And there's always a substantial level of unclear cases. In 2008, they were really starting to get a bit out of control, and once again I made an effort to try and bring that figure down a bit as well. So in other words, what we're really looking at is about 2/3 of people who followed up said that the child, usually because it's children, not always, but usually the child was better. In some cases much better, in other cases better. And then, you know, in most of those cases there was still work to do, not all of them. Some of the ones that said strong improvement were finalised. And there are also unclear cases. And by the way, part of the reason for unclear cases is that whenever I strike the point of collecting data, in this case the end of January 2018, there's always cases that have only just come in the last 2 or 3 months where I may not have had a feedback of any significance, or there may have been feedback but it wasn't clear yet what was happening. In other words, we started very conservatively with a low potency, might have been a little bit of a change, not enough to say, okay, that's definitely an improvement, but we kept going, and then in a month or two after that you could make a decision. So that gives you an idea of the sort of situation I'm experiencing with my own patients. Certainly I make no claims that everyone gets cured, because everyone doesn't, unfortunately. I'm sure if they were all patients who lived close to me and there was good follow-up, the results would be better, but that's what they are in my situation. But prevention of vaccine injury, the only way to certainly prevent vaccine injury is don't be vaccinated. I mean, that's a simple fact. You can do things to try and minimise damage, but that's the only way to be sure of protecting and ensuring the person is not vaccine injured. But there are circulating diseases which are potentially serious, and meningococcal meningitis is one of the most serious of all of them, where prevention is preferable to treatment. And Hahnemann talked about 1798 when he intervened scarlet fever with belladonna and wrote it up in 1801. He talked about how better it was to prevent than treat, even though we had a great form of treatment. So homeoprophylaxis offers the ideal solution. It offers a significant level of protection with no risk of toxic damage. And time and again, patients ask me, well, why isn't the government looking at this? And I don't like conspiracy theories, I'm not going to get into them, but I think as Bill Clinton once said, follow the money, stupid. So let's look at homeoprophylaxis. I define it as the systematic use of potentized substances to prevent the development of the characteristic symptoms of targeted infectious diseases. So when I say systematic, the remedies are selected according to the principle of similars and prescribed according to the principle of minimum dose. It's not some random selection. And when I talk about the characteristic symptoms of targeted infectious diseases, the reason why Kemp said, that great homeopath from America, said that prevention is much easier than treatment is because what we're trying to prevent are the common or characteristic symptoms of the diseases we're targeting. And that's easier than treatment. So Hahnemann first used HP in 1798, and it's been used by the masters of homeopathy since then, to the present day. Now, I published last year 3 different articles looking at different aspects of a data set which I've put together, looking at the use of homeoprophylaxis in 3 countries, Cuba, India and Brazil, in over 250 million people on an annualised basis. And when I talk about an annualised basis, it's by person, by year, by disease. So in other words, as I say down the bottom, for example, the final Brazilian program, which ran from 2007 to 2012, is counted as 6 years, not as 1. And so if a person was intervened, say, in 3 of those years, that would count as 3, not 1. And that's where we get the 250 million. I've done an estimate. This would probably be around about 35 million different people, because the big Indian intervention against Japanese encephalitis ran for 11 years, and they were doing 20 million children a year. So some of the children would have been in the program for most of that time, and some dropped, older children dropped out after a year or 2, and some very young children would have come in at the end. But it's a large data set. Now you can see the 3 articles there. The one down the bottom is a free online article put out by Jane Publishers in something they called Homeopathy 360. But the other 2 were in peer-reviewed journals, Similia in Australia and the American Journal of Homeopathic Medicine in America. And when you look at the data, which I'm not going to do here, it takes a long time, there's a lot of it, there is a degree of consistency across the HP interventions with a range of effectiveness between 63% and 99% and a weighted average of around 89.45. Now, these were interventions in short-term or epidemic situations mostly, although the large Japanese encephalitis intervention involved annual doses, 1 month a year, which is very similar to what I do in endemic situations in Australia. And my study showed an average effectiveness of 90.4%, and the 95% confidence limits were 87.6 and to 93.2. And they're important because basically if they're not tight around the mean, it shows that we can't have a lot of confidence in the figure. But it means with the 95% confidence that the worst result was 87.6, which is still very close, very comparable to vaccines. So homeoprophylaxis is an attractive option for individuals as well as governments. It can be used in both short-term acute epidemic overseas travel conditions as well as long-term endemic conditions. And of course, what is one country's endemic disease is another country's overseas travel disease. And we know, for example, in Australia, that things like cholera and typhoid, things like dengue and malaria are basically diseases that Australians have to worry about when they're travelling, but in some countries overseas they're endemic. HP is readily adaptable to changing antigenic strains of diseases, a huge advantage over vaccines, where if the strain changes it can take years to develop a new vaccine. It's easily administered, little pills or drops. It's well accepted and tolerated by recipients, and particularly the little pills. Kiddies love them. It's very economical. I remember when Dr. Bracho and I were in Cuba, were trying to work out with the swine flu intervention, a rough idea of the cost, because you see, the Cuban government, when the swine flu came out in 2010, they instructed the Finlay Institute there to homeopathically immunise the whole country over 12 months of age, 9.8 million people. And The Australian government, in contrast, spent $120 million, something like that from memory, to buy millions of doses of vaccine, most of which were never even used. And we worked out that the cost was about 20 times more with the vaccine. And that's not really factoring in the increased burden of chronic disease, just the actual cost of the HP compared to the vaccine. And it does not increase the burden of chronic disease. And as I showed you earlier, that burden of chronic disease is significant. It is not a trivial matter. Now, I'm not going to talk about COVID-19. There's a reference here, hpathy.com. And if you just go on hpathy, you'll find my essay there with a bit of looking, but if you want to copy that whole link, Preventing COVID-19, How Homeopathy Can Help, you'll see an essay which I put up. I wrote it at the end of February and it went up this month in March. And I'm not going to talk about COVID-19 here. I would rather that you read the article, because as I say in the article, the way things are in Australia with natural medicine and with things like this, I can be prosecuted if I talk about COVID-19 in any detail. But what I can do, and what I have done in the article, is talk about what I would do if I was in a position to. And I've looked at the different options, some of the different options in preventing. I'm a very proud Australian, but I'm ashamed of how intolerant the health system has become for various reasons, but we won't go into them here. But if you're interested in the ways that homeoprophylaxis can be considered to be used, then you can look at that essay. So in conclusion, homeopathy has a great deal to offer citizens and governments when it comes to the treatment and prevention of targeted infectious diseases, as well as the treatment and prevention of vaccine injury. You know, basically, the only way, as I said before, that you can guarantee that a person won't be vaccinated, won't have vaccine injury, is don't be vaccinated. But for many people, that's understandably not acceptable if there's no other option available to keep their children safe against potentially serious diseases. But there is an option. And so with homeopathy, not only can we offer great help to people who suffer vaccine injury, we can provide others with a way to certainly prevent vaccine injury occurring, but yet have a significant level of protection. Homeoprophylaxis is not 100% effective. Nothing on the planet is, as I said before. But all the evidence suggests if you've got an average effectiveness around the 90% mark, you've got something which you can say to anyone, including the Prime Minister of my own country, this is worth considering. This can save lives. It can save billions of dollars, including billions saved by reducing the burden of chronic disease. You know, in Australia, the Australian Bureau of Statistics used to publish about every 12 years a summary of chronic disease rates in Australia. They don't do it in the same way anymore. They're probably told not to. Because the last lot of data they published showed that 40% of children in Australia, 15 years and under, had at least one chronic disease. Well, if 40% of your young people have at least one chronic disease, what do you expect for the future? And when you go through the higher age groups, of course, the number just rises exponentially. We have to do so many things to bring that rate down, reduce toxins in our society, improve the quality of our foods, stop electromagnetic radiation getting more and more intense. And I think the 5G rollout, for example, it's starting to be denied in some places that are actually getting data and thinking about it. It's not all about how quickly we can play our games or how quickly we connect with business. It's also about our health. And this is an issue at the core of health. Vaccine injury, preventing that, but also reducing the burden of chronic illness in our community and giving people a genuine evidence-based option. And that's what we can do with homeopathy. Now, if you wanted to learn more about both of these topics, I've written a variety of books and many articles on them. There's also 2 web-based courses available for practitioners and also courses available for parents as well. An outline of the sessions in the vaccine injury course, how do we know vaccines cause damage, type and extent of damage, what is ISAC's evidence-based system for treating vaccine damage, what can your patients expect from treatment. Mums and dads would benefit from the first of those 4 without a doubt. Materia medica of vaccines. And you see, that's the sort of graph I was showing you before, a repertory of rubrics of vaccine remedies. My system in more detail for treating vaccine damage and long-term case management. There was a frequently asked questions section, an updated materia medica. Then a lot of case studies. There were case studies through all of those chapters, but particularly in the end. How to treat vaccine injury, practice management questions, and 6 critical things you should do when working with any vaccine injury case. So I've tried to make that a very, very thorough resource for any practitioner of any modality, but particularly for homeopaths who want to use these homeopathic potencies of vaccine remedies in their clinic. And with the HP course, what is homeoprophylaxis? Do we really need it? A couple of sessions on short-term HP, a couple of sessions, 3 sessions on long-term, evidence of effectiveness, evidence of safety, philosophical issues, a session on mechanism of action and conclusions. So once again, the aim of this is to try and allow practitioners of any modality, but particularly homeopaths, to be able to implement an HP program in their own clinics, whether it be short-term or long-term. I hope this has been some help. It's been a very quick run through 2 large topics, but hopefully it will give you an indication of how homeopathy can potentially assist you and your patients in a whole range of ways that are really topical and relevant right now. Thank you very much.